Hi Joan, my name's Rachel. Nice to meet you.
Nice to meet you too.
I'll be your massage therapy student for today. So we're going to go over your health history form. I see that you're coming in for shoulder issues today, your left shoulder, having some pain and discomfort there. I'd like you to follow along with this. So the importance of having an accurate health history form is just to ensure that we have a good idea of your background and what you're coming in and what you're presenting to us. It will give me a good idea of how the treatment should go. So it's just important that we go through your health history and make sure that it's accurate as possible. Okay? So looking at your health history form, I see that your occupation is a receptionist. And for about how long have you been a receptionist for?
For about 25 years.
For about 25 years. Okay. And do you know how many hours you put in a day?
It's an 8-hour day and I get an hour for lunch.
Okay. And do you know the setup of your desk? How is your desk set up?
I don't really know, to be truthfully honest. I'd say it's probably about there.
Oh, okay. So hands are up a little bit. That can be contributing to the discomfort you've been feeling.
Oh, okay.
Now, are there any hobbies that you enjoy doing after work?
Well, I used to like to play tennis, but I can't with this shoulder now. It's limiting me to too much pain.
So that's something you'd like to probably get back to eventually?
Yes.
Okay. So continuing through your health history, I see that you have checked off that you have high blood pressure.
Mm-hmm.
And do you know what a normal reading would be for you?
About 140/90.
Okay. And for how long have you had high blood pressure for?
Since I was about 40 years old.
Okay. Is it controlled by medications?
Yes, I have a diuretic.
A diuretic to help there. And I also see that you have checked off that you have a family history of the high blood pressure. Who in your family has it?
My mom and my dad.
Oh, so it comes from both sides.
Yes.
Okay. And so as we continue through the health history, I see you have checked off diabetes.
Yeah.
Do you know if you have type 1 or type 2?
It's type 1.
It's type 1. When were you diagnosed?
When I was about 20.
Okay. And how is your diabetes controlled?
With an insulin pump, I get injections into the right thigh.
Okay. Did you take your blood glucose level reading this morning?
I did.
Was it normal?
Yeah, it was about 7.
Okay, perfect. Now, so in terms of your primary complaint of the shoulder, are there any of your activities of daily living that are affected?
Well, as you can see, I'm having a hard time brushing my hair.
Yes.
And getting on my coat is difficult too.
Okay. Is there anything that could be contributing to that pain, such as overuse or anything like that?
Well, I do tend to hold my stress in my shoulders.
Okay, so that's where you're holding a lot of that stress?
Yeah, holding that.
Now, before I ask some more specific questions about the pain you've been experiencing in that shoulder, what are your goals for the treatment today, and what area would you like to focus on?
Oh, definitely my shoulder to decrease that pain.
Okay.
And, maybe be able to play tennis again.
Oh, that would be wonderful. So now I'm going to get into some more specific questions about the pain you've been experiencing in that shoulder. So can you point to the general specific area of where you've been feeling the pain?
It's generally here.
Oh, okay, so it's kind of in that area.
Yes.
You can't really point to a specific spot?
No.
And when did you start to feel the pain, the onset?
I would say it really started bothering me about 3 weeks ago.
Oh, okay, and it's been gradually getting worse?
Yes.
Okay. And does it refer or radiate anywhere?
No, it stays right there.
Okay. And how often or how long does the pain last?
All day long.
All day?
Yeah, all day, every day.
Every day okay. Now on a scale of 1 to 10, 1 being little pain, 10 being a lot of pain, where would you say your pain level is at?
I think I have to say an 8.
An 8. So it's pretty high.
Yeah, it's very bothersome.
Okay. Can you describe that pain in your own words?
I'd say it's stiff and painful and limiting.
Limiting, okay. Do you know what caused it?
I'm not really sure, but it's been progressively getting worse.
Right, okay. And it just kind of came on, you said?
Yeah.
Mm-hmm. And what aggravates the pain?
It actually kind of wakes me up at night if I was sleeping on it.
Right.
Obviously brushing my hair.
Yes.
And
putting on that coat.
Getting my arm into the coat.
Okay. Anything that gives you some relief from that pain?
I've been taking some Advil, but I
Right.
try not to take it very much.
Oh, okay. Did you take the Advil this morning?
No, I don't think I did.
No, not today? Okay. just wondering for when we get into our treatment. And so other than the Advil and insulin, are there any other medications that you're on? I think you had mentioned diuretics as well.
Diuretics for the hypertension and insulin for the diabetes.
Right, okay. Any other comments you'd like to make about this pain?
No, I don't think so.
Okay. So now that we've gone through your health history, the interview questions and pain questions, I'm going to take you through a brief postural and gait analysis. So for this, I'm going to get you to stand up,
Okay.
facing me to start with. So I'm just assessing, starting at your feet, to your ankles, moving up to your knees, looking at your hands, the hip level, looking at your shoulders now. I can see that we're holding that left shoulder a little bit, protecting it. I'm going to get you to turn facing forward. Looking from this view, I can see that we have rounded shoulders, forward head posture. So we're looking at upper cross syndrome, which could be contributing to that pain we're having in the left shoulder. I'm going to get you to turn to face away. So same thing. Is it okay if I palpate?
Yeah.
Starting down, looking up. On palm palpation, I can feel that the left shoulder's holding a little bit of tension up in the upper trapezius on that left side, and which again could be contributing to some muscular imbalances and contributing to that pain we have been feeling there. Okay, I'll look at your other side briefly. And same thing here, still seeing that rounded shoulder. So now I'm going to get you to do a gait. So I'm going to be watching you walk down and back.
Okay.
So whenever you're ready, you can go ahead for a walk. So here, again, I'm just noticing we're holding that left shoulder, protecting it, which again can be contributing to the pain we've been feeling there.
Okay.
And that's everything for that.
Joan, thank you so much for filling out our shoulder pain and disability index. I see that you've scored a 78% here, so that does indicate to me that there is much room for improvement. I'm hoping over the next 4 weeks of massage therapy treatment that we can get this number down to a 50%. Okay, so we'll aim for that improvement.
Alrighty.
Great.
Up next, we're going to be doing the assessment. For the assessment, due to the time restraints that we have, we're going to assume that resisted contraction is build for 5, hold for 5, and the patient is going to express the pain that they have.
Hi Joan, now we can move on to the assessment. So for the assessment, it may recreate your pain. So I want to control the pain on 7 out of 10. If the pain run out of 7, just let me know. I will stop it right away. So do I have your consent to do the assessment?
Yes.
Okay, now we're going to do the active, passive, and the resistant. For active, I'm going to demonstrate you, and you're going to mirror me. And for passive, I'm going to move you, and you don't have to use your muscles. And for the resistant, please don't let me move you. Okay, so first we're going to do the shoulder flexion. Please bring your arm up. Thank you.
And there's some discomfort.
Okay, 101. Now we're going to do the passive. Relax.
Some discomfort.
Okay, now we're going to do the resistant. Just don't let me move you. We're going to build for 5 and hold for 5. Great, I will give 5 out of 5. Now we're going to do the shoulder extension. Please bring your arm back.
There's some discomfort.
Okay, it's 20. Now we're going to do the passive.
Some discomfort.
Okay, now we're going to do the resistant. Don't let me move you, okay? Relax. I will give 5 out of 5. Now we're going to do the abduction. So please bring your arm from side to top.
There's pain.
There's pain. So it's 105. Now we're going to do the passive.
And pain.
Pain. Now we're going to do the resistant. Push into my hand, don't let me move you. Great, 5 out of 5. Now we're going to do the abduction. Please bring your shoulder toward your body.
And there's discomfort.
Okay, 25.
And there's discomfort.
Discomfort. Okay. Now we're going to do the resistant. Don't let me move you. Great, 5 out of 5. Now we're going to do the horizontal abduction. Yes, please. Okay, please do the horizontal abduction for me. Good. 30. Now we're going to do the passive.
There's just a little discomfort in both of those.
A little. Now we're going to do the resistant. Don't let me move you. Great, 5 out of 5. Now we're gonna do the horizontal adduction. Please bring your arm back side. Now it's 100. So we're gonna do the passive. Relax. Okay,
And a little discomfort in both of those too.
a little bit. So don't let me stop you, okay? Good, 5 out of 5. Now we're gonna do the lateral rotation. So lateral rotation. Okay, please do the lateral rotation for me.
There's pain.
There's pain, 25. Okay, we're gonna do the passive. Relax.
Pain.
Pain. Okay, we're gonna do the resistant. Don't let me move your hand. Relax. 5 out of 5. Now we're gonna do the medial rotation. Just wait a second. Okay, do it.
There's pain.
Like 15. Okay,
And pain.
pain. Now we're gonna do the resistant. So sorry, just let me move you a little bit. Now don't let me move you. Push into my hand. Great, pretty strong. 5 out of 5. So that's all for range of motion. Now we're going to do the roll out. I'm going to do a roll out on your neck and on your elbow. So can you please bring your chin to your left shoulder? Any pain?
No, just stiff.
Can you please bring your left earlobe to your left shoulder? Any pain?
Just stiffness.
Okay. Still no pain?
Stretching.
Got it. Now we're going to do the roll out on your elbow. Can you please do the elbow flexion? Any pain?
No.
No? Still no?
No.
Now can you please bring your palm down? No pain?
Nope.
No pain?
No.
Great. So now we're going to do the special test. The special test name is apple scratching. It's testing your shoulder mobility. So can you please demonstrate that?
It's hard to get that left over.
So it's hard. Can you please try another way?
And it's hard to reach the left under.
Oh, okay, I got it. So we're gonna redo this special test after 4 weeks treatment. So we're gonna see if there's any mobility improved. Now we're gonna do the functional assessment. Can you please show me how do you brush your hair in daily life?
I have to kind of like go like this or use my other
Okay,
arm.
I got it.
Yeah.
Joan, I'd like to take a moment before we get you on the table to go over some of our treatment outcomes as well as modifications to treatment today.
Okay.
Okay, so although there are no direct modifications or contraindications for adhesive capsulitis, I would like to consider the diabetes as well as the high blood pressure. Now, even though I understand you do have controlled, both our situations are controlled, we will be mindful of applying heat today. We will use heat, but I will reduce the time by 50%, in addition to double wrapping the heat pack to provide extra protection.
Okay.
I'll be modifying by watching my deep pressure techniques as well as reducing long strokes for any superficial fluid techniques that I use today. In terms of positioning, for the prone position, which is face down, we will be doing just a limited time for that as well. We're going to be mindful of that, and I'm going to have you in a semi-seated position when you're on your back, okay?
Okay.
Now, in terms of our treatment outcomes, we will be addressing some fascial adhesions. I suspect there'll be some in your chest area as well as in your shoulder. We'll be working on reducing tension in the pectoralis area as well as the rotator cuff muscles. We're going to be assessing muscles such as levator scapula, your rhomboids, supra and infraspinatus. We're going to be looking for some trigger points that may be hiding there, and we will be doing some range of motion techniques that are going to help get that internal and external rotation and all of the other ranges of motions back moving more fluid for you.
That would be good.
We're going to try to unfreeze the frozen shoulder.
Oh, that sounds great.
Great.
So today we're going to be treating adhesive capsulitis, and we're going to start with some gentle rhythmic moves. But because this is fairly acute, we're going to be very gentle about those lobes. They're going to be in very small circles. How is that?
Great.
Is it painful at all?
No, that's within my tolerance.
Okay, and so we would do that for a few rounds, but due to time we're going to move on. So gently put that arm back down. And now I'm going to go into a V drape. So I'm just going to come over to your other side and tuck that shoulder in. So if I can just have a little bit of that. There we go. You want to tuck your arm in and under. Perfect. I'll pull that one back a little bit for you. Tuck that nice and firm. I'm going to come around to the other side. Okay, so as I'm going to slowly pull that down to the xiphoid process. If at any time you feel uncomfortable, just let me know.
Do you want this arm in?
So, yep, if we can put that arm in too. And I'm just going to start feeding that down. I believe we'll have that xiphoid process right there. I'm going to tuck that under. I'm just going to use this towel just to secure that in. Do you feel secure?
Mm-hmm.
Okay, so first we're going to warm up that tissue because we're going to treat some fascial, first I'm going to check. Find out which way our fascial adhesions are. Okay, I do see we do have some. So I'm going to warm up that tissue with a little bit of effleurage. Okay, and then I'm going to come in for some skin rolling. I'm going to actually move towards chest. How is that? Are you okay?
Mm-hmm.
Not too pinchy?
Nope.
Let's go with a little release, fascial release happening. This, sorry, I'll bring my thumbs in so I'm not poking you. Okay, now I'm going to redrape so that I can get at that shoulder. So if you'd like to take that arm out, perfect. Now tuck under that pillow. Now we've elevated our client into semi-recline due to the high blood pressure. There we go. And just tuck it in there. Okay, and I'm just going to I'm only going to treat the affected side due to the limitation on time today. So let me come back over. And we'll test where those fascial adhesions are in the shoulder. Okay, I'm going to warm up that. Okay, and then we're going to start with some skin rolling. Now how's that feel? Not too pinchy?
That's good.
Okay, and then we're going to do some myofascial direct. I'm going to follow the direction of the deltoid fibers. Okay. Next, we're going to move on to draping for some work with a pec minor. So is it okay if I do that drape?
Yep.
Okay, so I'm just going to move that down a little bit so that I have a little bit more room. You can actually just relax that. But if I could get you to just as much as you're comfortable. There, how does that feel?
Good.
Good. Okay, so first we're going to get into that pec minor. I'm going to actually get you to bring your arm across so that I can get access to it. Okay, and I'm going to get you to inhale. And then I'm going to go in a little deeper. How does that feel? One more time, inhale. And as she's exhaling, getting into there. And so what I'm going to do is a pin and stretch, but I'm not going to stretch that arm very far because of that adhesive capsulitis. It's going to be making it very tender. So I'm just going to do a little pinch and stretch. How does that feel?
Good.
Okay. Try moving in this direction. One more time. We could do this probably about 3 times, but again, with the limitation on time. Okay, I'm going to get you to inhale and exhale, and I'm going to pull out of there. And then I'm going to go work on doing some scrubbing on the subscapularis. So again, I'm going to have to go in, but I'm going to go more towards your back. Are you ready? Okay, take a deep breath. And as you breathe out, one more time. There we go. So I'm just applying some scrubbing to that subscapularis. Small circles. And then some back and forth. Okay, I'm going to get you to breathe. And then as she exhales, I'm going to withdraw my hand there. I'm actually going to re-drape. Okay, so I'm warming up those neck muscles with a little bit of effleurage. Oh, I think that's a bit of a tight band.
Wow.
Oh, that must be a nodule. Oh, there's a twitch response.
Yeah.
Are you?
I'm kind of sweaty.
You're feeling sweaty?
Yeah.
Okay, that indicates that there's a trigger point.
Okay.
Are we okay if we do a trigger point treatment today?
Yes.
Okay, then we should set a pain scale.
Okay.
What would be a good pain scale for you?
Out of 10, I would say my pain level would be 8 out of 10 I can handle.
Okay. Due to the treatment modifications, I think that we're better to go with maybe a 6 out of 10, and you can just let me know,
Okay.
just to address that high blood pressure.
Okay.
Okay, so I'm just going to strip that muscle from the scap up to the TVPs. Oops. I'm going to apply a little specific compression. How's that for pressure, okay?
Good. My pain is starting to go away.
Oh, good. So I'm going to release that, and then I'm going to flush that out. And then I'm going to stretch that. Good. And then I'm just going to apply a little heat to that also. There we go, and as I'm waiting for that heat, I'm just going to continue to treat. Oh, it's already been 5 minutes. I'm just going to check that. How is it for you?
Good.
Okay. Oh yeah, that's still okay. Roll underneath your shoulder just to help reduce any pain. How is that for you?
Good.
Good. Okay, so the next thing I'm going to work on is your rhomboids. Just with that hyperkyphosis, you need to stimulate those rhomboid muscles. So I'm just going to warm up that tissue. And then I'll do a little chipotle mint. And then I'll do it for about 30 seconds quickly in multiple directions. How are you feeling?
Good.
Okay, and then let's buffalo wash that out. Don't go too deep. There we go. And I'm just going to re-drape you.
Rock her now.
There you go, and that'll be the end of our treatment for today.
Joan, I would like to send you home with some home care instructions. These instructions include 2 exercises as well as some hydrotherapy. The exercises are geared towards creating some range of motion and loosening up the joint capsule. The first one that we'll be doing is called the pendulum, and to do that I'll need you just to lie on a bed. Let me demonstrate it first. Okay, so when you're at home, just leaning on a surface, we just need to make sure that you have full access to let gravity and the weight of the arm take over, and we're just going to be doing small circles. Okay, and you can do this 10 circles in each direction, and if you could do that once a day, that would be very helpful. Moving on, we will do the wand exercise, and to do that, we're just going to lay down on your back, and you're doing small controlled movements, raising the pole up and over your head within your limits, back and forth. And if you could try that perhaps 5 times a day, that would be great. Now, if you wouldn't mind, if I could have you demonstrate those movements for me. Okay, I'll take that first. Great. Okay, and now we'll try the wand. And just working within your tolerance. Excellent. Good job. Thank you. You're clear on those instructions?
Yes?
Okay, and while you're here, I would like to just explain diaphragmatic breathing to you. This is a nice exercise that you can utilize if you're feeling stress or anxiety, or if the pain is really bothering you. So for diaphragmatic breathing, we want to practice breathing in through the nose and out through the mouth. Okay, and just put your hands on your belly here, and I'm just going to put my hand on top. I'd like to see the rise and the fall of your breaths, please. Okay? So you're letting your body, giving your body permission to breathe in through the nose and out through the mouth. That's great. Breathing in for 3 to 5 seconds and out. Good job. Perfect. So you can practice that at home anytime you're feeling like you need to just de-stress and ground yourself. Okay? Do you have any questions?
I don't think I do.
Okay. Come on up and let me just talk to you about the hydrotherapy. What I have here is a heat pack that has been double wrapped. We do want to be mindful of applying too much heat. So when you're at home, we're just going to place the heat pack directly over your affected shoulder. Yeah, okay, so I'll practice on the right shoulder right now. So you're just going to lay it over the shoulder. Normally I would recommend doing that for 10 minutes, but we're going to do a reduced amount of time for 5 minutes, okay, per evening. Okay?
Yeah.
Wonderful.
Thank
Great.
you.
You're welcome.
Thank
Great.
you.
You're welcome.
I don't know. So continuing through your high blood pressure, or continuing through your health history here, I see that you've checked all high blood pressure.
Yes.
What's a normal reading for you?
About 140 over 90.
Okay. And how long have you had high blood pressure?
Oh, since I was about 40 years old.
Okay, so for quite a while.
Yeah.
Is it controlled by medications?
Yes, it is controlled by medication.
Okay.